Okay, so welcome everybody. As I said earlier, the session is being recorded and should be now on its way. I apologise, I seem to have frozen on screen. I'm hoping that that will sort itself out, but that you can still hear me. If anything goes wrong with my tech, I'm not quite sure. Oh, there I am. I think I can. It's going slow though. Julia is on hand, at least for now. I know, Julia, you have to leave a little bit earlier today, don't you? So hopefully that'll get sorted. We have had a couple of apologies from governors, so we'll just note those formally. Linda Cox, Richard Amponza and Roshni Khatri have given their apologies formally, and exec NED apologies from Judith Seymour and Rackham. I know that a couple of non-executive and executive colleagues do need to leave a little bit earlier due to other commitments, but we have slightly rearranged the agenda, I think, to accommodate people today. So bear with us on that. And I don't think there's anything else to add, so we'll crack on with the second item on our agenda, which is declarations of interest. Is there anything that anyone wants to declare specifically for the agenda today? Obviously, if you have got any updated declarations of interest, you can send them to the Foundation Trust inbox. But if there is anything specific to today's agenda, then now is the moment to declare them. Okay, I'll take that as a none. Okay, so minutes of the previous meeting then. So our last meeting in July, is everyone content that they are an accurate reflection of the last meeting?
For you.
Oh, Angela Hillary is on the call.
I can hear someone speaking. Their volume is probably not muted, so just in case you meant to mute yourself but you haven't, you might want to do that. So just on the draft minutes then, is everyone content to approve those? Yeah, nothing anyone wants to identify as a correction.
Members came to invest in the well-being and future of our young people, and we recognize young people.
Okay, so I think that's just buttons not being muted, but we're okay. I think we can carry on. So I'll take the minutes as approved. Thank you very much. And we shall go to the action log. So action 65, that's the only one that's outstanding, and we'll pick that up. I think we're still exploring the answer to that question, actually, so we'll bring that back to you. So we'll note that as remaining open for the time being. So that's item 4 on our agenda. So we're going to move straight on to session 1 in our business today, which is, as I said, I've moved the agenda around a little bit. And so on the strategy and assurance session, we've got item 5 first, which is our feedback from non-exec directors on risk and assurance topic. Now, just for colleagues who weren't part of the session, we did have a prior workshop to the Council of Governors meeting just to talk a little bit about how non-executive directors gain assurance. And today, one of the things we wanted to do was share with you a couple of areas that we discussed at our last board that have been reported to the board from our various committees as areas where non-executive directors wanted to just highlight to the board that there were some areas of concern and where the board needed to be aware of some of those issues that we were dealing with. So we've got that on the agenda, and we've got Julia Curtis and Suki Bali leading on that. So I'll hand over to both of you to manage that item for us. Thank you.
Thanks, Krishni. For those of you that don't know me, I'm Julia Curtis. I'm one of the non-execs, and I chair the Quality and Safety Committee, along with Robin, one of the other non-execs who's the deputy chair, and he'll chip in, I hope, and join us after the slides if there's anything to add in. So, as Krishni said, I think I'm going to just talk you through just one brief slide about how we escalate issues from our various committees, and then take one of the topics that we did escalate at the July board and give you some background to the assurance that we took around these issues. So the two issues from the Quality and Safety Committee was around access to services, and specifically children's ADHD and autism services. And then Saqib will focus on the spend on temporary staffing, so agency staff, etc. So could we have the first slide, please? Thanks, Richard. So just as a little bit of background, the committees of the board provide regular reports to alert, advise and assure the board on key issues. I won't go through each of these points, you'll be able to read them, but basically the committees work on behalf of the board to oversee financial performance, quality of care, etc. Each is chaired by a non-executive, and we meet most of them every 2 months, and then we provide assurance to the board on the huge plethora of areas of activity that the organisation covers. So one just thing to add in here is that, of course, we do see a lot of data at all these committees, and all the data relates to patients, service users, families, and staff. So we take this very, very seriously, because we're not looking at numbers and we're not looking at colours and RAG ratings. We're thinking about people all the time at the back of our minds. And I just wanted to put that at the front of this, the first session. So the assurance to the board then is from all the different areas on our different committee work plans, and it comes, as I say, in the form of an alert, advise or assure segments. So the alert sections are matters that really specifically need the board's attention, where we're not convinced about or we're concerned about assurance or gaps in assurance. And advise is where there's ongoing monitoring or development, and the assure is where there's positive evidence received. And there's a wealth of different subject areas in each of those every time. Really important, though, the point underneath, reports also enable a committee to escalate risks, really important, but also that we share outstanding practice, and that's equally as important, because it's one way that we can help others see some of the outstanding work that we see firsthand in the committees. And then the board finally triangulates that assurance reports with many other reports and other activities that the board undertakes, and then we can identify if there's any immediate action needed. So that's the framework for this. If I could just have the next slide. So in July, the board were alerted around children's ADHD and autistic spectrum disorder service and the use of agency staffing, and I'm going to focus just on that first one. If I could just have first slide. Okay, so the issue around the ADHD and autism service, this is not new. This has been around quite some time, and children are waiting much longer for assessments than we would like. We've been very open and transparent about that. I think we've been monitoring this since I started 2 years ago, and certainly previous to that. And we seek constantly assurance from our executive colleagues and management teams about the actions they're taking to try and keep people safe while they're waiting. So in the committee, we review data from the service. We look at information from the performance teams, outcomes of audits, and we're able to constructively challenge and ask questions of the accountable directors in the committee, just to make sure we've covered all angles, even if we can't actually solve the initial problem. And I had a quick look back at this issue, because this is covered in the performance committee too, from a different angle around our trust performance. I looked back at the last performance report, support, and the demand has tripled since the pandemic for this service, and that's huge. And there are many complex reasons that people are waiting a long time. And what we ask is, okay, is the service looking at all the ways to become more efficient? Have we done everything in our power to do that? And then, of course, we are part of a wider system, which I'll come on to in a second. So significant increase in patients referred. That is a national trend, and we're feeling the effects locally. And when the caseload for this service was analysed, many of those referred have very complex needs, which, as I'm sure you'll appreciate, is very challenging for the service to manage. However, a recent audit suggested there might be an opportunity to reduce waiting times by changing the way the service actually screens and assesses patients. So we're having to think very differently. You can't keep just adding more and more numbers, more and more people, more and more children needing assessment with a similar number of staff without changing something. So they're actively looking at that. And they're also, the management team, working with partner organisations across the system in trying to improve access to the service. And that's involved a huge amount of effort. And I know we seek assurance constantly that our executive colleagues are involved with the right people and groups across the system, and hear frequently about their efforts to keep this as a focus. So just two extra quick things to add. One is that we take every opportunity to raise this wherever we can as non-execs, and we recently hosted the deputy chair of the integrated care system at one of our local community hospitals, and the leaders of this service were actually there, and they highlighted in no uncertain terms the challenges, but also the successes and the things that the innovations that they're trying to achieve to help children and young people. So I'll just bring Robin in, if I may. If there was anything from the recent, I was away for the last committee, if there's anything else to add alongside what I've just described. Robin, is there anything else particularly?
Yeah. Thanks, Julia. Yeah, I mean, this one, I was chairing the last two of these committees, and the decision to make the alert to the board was made the one before last, and then it was considered again at the last committee last week, and we decided to re-alert it to the board again. And I hope governors will appreciate from this the seriousness with which we take these big red flag issues, like the lack of access to service as such a high priority area of need, and we're not unprepared to put that challenge back to executives. We hope to see some sort of action, and of course executives are fully committed to that themselves, and we know that by raising it and by alerting it, we know already, because of reports we get at the committee, the seriousness with which this is being taken. But it is a system issue, and it is very much one that needs to be seen as part of the, not just entirely within NHFT's gift. And we have to find a kind of collective way of resolving this. But by keep flagging it up, by keep putting it right at the top of the agenda, is the only way really that we can ensure that there is really focused action upon it by all partners working together. So it illustrates how the system works by really addressing the key things, keep flagging them, in this case at the highest level. We do our best to ensure that we can get some dynamic change to the way that these young people are being treated. And I think there is some real concrete action being carried forward as a result of all this concern.
Thanks, Robin. Do you want to move on to Saqib and then come back to any questions at the end? Yeah, Saqib, did you want to take the next slide?
Yeah, thank you. So my name's Saqib Ali. I'm a non-exec director and audit chair, and I'm going to be talking about agency staffing, which has been running above target. So the Integrated Assurance Committee is responsible for monitoring these people matters, and the reason that you'll see that agency is important is for a number of reasons. One, it has an impact on costing. Secondly, it has an impact on staffing, and each meeting we receive a report on the agency level on a workforce dashboard. And in May, the number of staff that work for NHFT was 4,928, with a turnover of 12% and a vacancy rate of 8.8%. The reasons why those are important will become apparent. So the connection, as you can see, between permanent staff and the improved outcomes, it's really important that the quality of care is always kept to the top of what we're trying to achieve. But it has an impact on the finances I mentioned. And so we try to minimise our use of agency staff where possible, trying to use bank staff. So the agency staffing levels are set each year and they're monitored at each committee meeting. So even though the expenditure was less than the equivalent point last year, it was still 2.6 million as at the end of June. And as I mentioned, it has an impact on finance, and we always try to keep patients safe. However, the vacancy rates do not necessarily match the use of agency and bank staff. It doesn't necessarily mean that if we have 100 staff vacancies, that the same 100 roles will be used in agency, because there might be people off sick, people might have left, we may be in between recruiting for a new role. The reason why agency staff is obviously really important is it costs more, and it has an impact both on morale, and it's not necessarily the same staff every day. So in terms of rostering and putting your teams together, it has an impact there. There is a system shortfall of staffing, and as we know, there's national vacancies across the board. And this is where it's really important as we train for the future. And the NHS work plan that some of you may have heard of has announced what it's planning over the next 5 and 10 years in different workforces. So we're briefed in committee on the significant efforts being made by the management team to recruit and retain permanent staff, and the vacancy rate has been coming down quite considerably. There have been deep dives and a strengthened approval process and improved registering processes and various recruitment and retention incentives. As people will know, through the cost of living crisis, people are often seeing, are they earning, doing a caring role versus a whole host of other employment opportunities that are out there. And we're working really hard, and we get regular updates at the various committees and board as to what's being done to retain staff, to attract staff. Obviously, NHFT for many years has been bringing in staff from overseas, and some feedback I had at a recent Reach, this is one of the staff forum, was what can be done to make it easier for staff that come from overseas to stay at the end of their contract on their initial visa periods. And so these are things that we need to consider, as well as when we're recruiting new people that will be UK trained and UK workforce. So the management continues to work closely with partner organisations, regulator and staff side representatives in the networks, as I've mentioned, to achieve our agency target. And this will be an ongoing thing. It's not going to be fixed overnight. It takes time to train people. It takes time to recruit people. And, sometimes people are in between jobs. They have different caring responsibilities. They decide to be agency while they're trying to work out which area they will work in. Once they're on board, then if they work additional additional hours, that's often through bank or through overtime. But this all has an impact on the costing. And so with the state of our finances, it's really important that we keep on top of this, that we recruit and retain full-time staff, permanent staff rather, and that we offer all the flexible working opportunities that they want, whether it's part-time, full-time, and all the different types of working in between. So that's all I wanted to add. Happy to take any questions. I'm not sure what was the next slide. Yeah.
Shall we hand back to you, Krishni?
Yeah, thanks, Saki. Before I bring in any questions from governors, was there anything that any other non-executive director colleagues wanted to add to anything that was said on agency? Or so, Joe?
Yeah, thanks, Krishni. I just wanted to give some feedback as well to governors. As a relatively new member of the board, as an associate non-exec director, the quality and volume of information that is presented to non-execs and the senior execs at these boards, you cannot underestimate the quality and range of data. I think the point to press home is, again, if we need more data, the data is provided. And it's down to us about the nature of the questions that we ask to elicit the right type of response in terms of the data reaction. So just to offer reassurance from a fresh voice that the quality of information that flows is really high. Thanks, Krishni.
Thank you very much, Joe. Okay, so As I think Julia alluded to at the beginning of this item, what we've tried to do is just sort of say a little bit more about two issues that were part of our reporting mechanism to board, highlighted as alerts to the board, key issues that we're grappling with. I have to say that those two key issues are unfortunately fairly common for most organisations around the country who are certainly the agency issue is an issue for everybody, all trusts, and also the ADHD waiting list is a common issue for community mental health organisations as well. So, but that, you know, doesn't underplay the amount of work that has to be done locally to try and, as Julia described, manage certainly the issue about waiting lists and agency controls. There are some standard and good practices that we're expected to put in place and scrutinise to ensure that we are keeping on top of that issue. So there's an opportunity, if anyone would like to, any governors would like to now, just ask questions about either of those two issues. If there's anything at all you want to understand more about how that's looked at, obviously I can bring non-executive colleagues back in. Also, we have executive colleagues with us who can add any other information that might be useful. So there's a few hands have gone up, so I'll just bring people in order. So first of all, Sharon, please.
Hi, just a couple of questions on the ADHD and ASD piece of work that you've been doing. How long is the waiting list? Is it improving? And how long before the benefits of the new assessment process that should reduce waiting times, should we be seeing the impact of that? That was one part of the question. The second is what partner organisations are involved in reducing the time and the amount of care that is given to those young people. And the last question, and probably the most difficult, is with regards to the complexity. You know, it was quite clearly stated, Robin, that it isn't within NHFT's gift to solve all of those problems. So who else is required to help make that happen? Obviously, I know that all of those questions are not easy questions, and it is a nationwide issue.
Thank you, Sharon. So I think you said the first question was how long is the waiting list? So I don't know whether anyone's got that detail to hand and can answer that. I think the second question you asked was around partner involvement and sort of bigger issues around sort of national action around this. David, I can see that you put your hand up, so yeah, are you able to come in?
I was just going to say, I think we'll probably just need to, I haven't opened up all the performance info and have it in front of me, so it's probably on the how long's the waiting list. One bit we'll take away, and if we just do it as a clarification point into the minutes or something, that would be great. That would be helpful.
Do you want to say anything about partners at all? And who we're working with to try and address this?
So I think there's a couple of bits I'll add, and then if any other colleagues want to, absolute recognition that we need to do this with local authorities, education partners, ways of working. So there's some really good conversations happening, children, young people for within our services. There's also the opportunity of exploring how we can use technology to help us and help get the right support to people. And we're trying to work through all of those different ways of building some things forward. So there is quite a bit going through. I've spotted that Dave Mayer's also popped his hand up, so he may have a little bit more from that.
Dave?
Yeah, thanks, David and Krishna. Hello, colleagues. So our waiting list, so across the region, some of the waiting lists are up to about 11, 12 years. Our current waiting list, we've got about 2,200 people on the adults list and a further 2,200 on children's. We we estimate that without doing the work that we're doing, it would take 3 to 5 years to clear that waiting list. But we're doing quite a lot of work on diagnostic pathways so that we can actually get people seen quicker, but also focusing on needs rather than diagnosis. So identifying where people have needs, if they have a problem that's impeding them at work, that we input some work support through our IAP services to keep them in employment whilst they continue on that diagnostic journey for treatment. Angela's obviously involved nationally and regionally with some conversations around ADHD more generally. It's fair to say I think the model will need to evolve and modernize as we begin to kind of know and understand it clearer, and the opportunities for populations in terms of recovery are great. It's probably one of the once you're diagnosed and treated, your recovery rate is fantastic, probably best in class in any mental health services. So we're working with primary care. Matt Metcalf, medical director in the ICB, is hosting kind of providers together, because there's quite a vibrant private sector provision for this as well, which actually makes the waiting list issue a bit more complex for us, because some people go private and then need to come back to us for treatment in terms of medication. So there's a set of things in terms of how we shape the market, which the ICB with Matt Metcalf will lead on. So I hope that's helpful. And as David says, we can keep live updates on this. It's work in progress, and we're all keenly involved in trying to improve it locally, regionally, and nationally, as Krishni said.
Thank you very much, Dave. It is, I mean, as you rightly say, I think it's a significant issue, and the waiting list is incredibly large in terms of the time scale for people currently, and that's why there's a huge focus on it both regionally and nationally. Pat?
Hello, good afternoon. Apologies, if I switch on my camera, I get booted out of my Teams. I do not know what is going on with it. Okay, he doesn't like my face today. So my question I have is around just listening to your staffing issues and turnaround. And maybe the information is somewhere that I haven't seen it, but the question I have, I hear that money's being thrown at it in terms of, you know, having to use agency staff and stuff like that. But do you have any data in terms of why your staff are leaving, other than, you know, maybe caring and all that, and perhaps shift rota issues and stuff like that? I mean, what is being done to sort of look at what the actual symptom is, and the onboarding process, is that being sped up, or, you know, that kind of thing? So because it's quite a high turnover. So my question is what is being done to look at what the reasons are? Are we looking at it through the staff surveys? You know, is there information that we can go and look at to sort of see what is being done, you know, what the staging is and all that kind of stuff? That's just what I was just interested in.
Thanks, Pat. So I think the sort of the agency is a symptom, isn't it? I think is what you're highlighting. Because obviously there are gaps, but what are we doing in terms of retention, I think is the sort of key question. So Scott, I don't know whether you want to come in. I saw that you put your hand up, but whether it was about that.
It was about that, Krishna. Yeah. And apologies to Mark Mayer. I know he's got his hand up, but if you don't mind, Mark, it was in response to what Pat's just asked. So Pat, I mean, I think, to be honest with you, that you know, just even the way that you framed the question is pretty much spot on as to in terms of how we. So I, up until recently, used to chair performance committee. I'm now the vice chair of performance, and this is a sort of a factor, an element that we discuss at length through an aspect of our overall performance and workforce reporting. And I can assure you that we have scrutinised all of the same areas, right from, you know, are we recruiting enough people? Have we put enough work into the retention of those individuals? Are we investing in them for the future? Ensuring that they feel supported? Are we carrying out all of their appraisals so that they feel respected as individuals? Are we paying attention to their workforce challenges? Are we looking at all of the options that we possibly can in terms of sources of recruitment, in terms including looking at international recruitment and training our own people, creating training modules with university partners and system partners as well. And the honest answer is that, genuinely and very comprehensively, we believe that that is already being addressed. That's not meant to sound in any way, shape or form sort of complacent, or that we've given it up as this is the best that we can do. But on a national basis, this is an absolutely wicked issue for the entirety of the NHS, and no one has cracked this. Our current vacancy rates fluctuate to a greater or lesser degree. And at the moment, it's probably slightly at the higher end of that scale than it would have been, say, circa 6 or 12 months ago. However, I can absolutely tell you that this is an area of ongoing focus for non-execs through the committees that I've already referenced and exec colleagues. I know that we get an extensive amount of detail, focus and assurance in this area that's led by Chris Oakes and supported by Dave Mayer and many others. So Pat, I hope that gives you some degree of comfort, but genuinely I think it's an issue that perpetually we are wrestling with as an organisation, and are always seeking to be on the vanguard of pushing ourselves to consider as many different options as we possibly can to address the challenge.
Thanks, Scott. I mean, I think Pat referenced the staff survey results, and I if I remember correctly, I think we did. Melanie might have done a bit of a feedback on our last set of staff survey results, which still show us performing above average, if I remember correctly, against our benchmark group. That we've, dare I say, always done relatively well. But there's always, that, as Scott made clear, that doesn't mean anyone can afford to be complacent. It is a constant challenge, I think, to ensure that we're doing everything we can to retain our staff, because I think you rightly point out that this is something, it doesn't make sense to lose staff and replace them, does it? So, or cover them with agencies. So actually, the key thing is retention of staff, creating an environment where people feel supported and valued, so they want to stay. But I don't think we should underestimate the challenges that, COVID posed, because post-COVID, it's been much harder, I think, for staff. Ongoing industrial action is not helping, certainly not in terms of well-being. So all those things are things that we're having to grapple with. But Julia, I saw your hand going up. Do you want to add anything to that?
Yes, thanks, Richard. Apologies again to Mark, if that's okay, just to come back on that. So 2 other quick things on that. So one way that we do hear directly from teams is through service visits and attending different events with staff. And I've had 2 or 3 recently where I can't believe it's been incredible, the local innovation to try and recruit people, because locally there are different challenges. You want some standardised systems and some standardised recruitment practice, but actually locally, some of the teams know the difficulties they have and some of the lengths they go to try and attract people in, talking with the local schools, etc. It's incredible. And then just to say that at a system level at the other end, I know that a lot of the exec team are hooked into various routes through our system to talk with other partners, because we can't just keep moving people around the system, poaching from one place, robbing Peter to pay Paul. So trying to make posts attractive, trying to look at people's roles where they can go in different organisations and making that easier, and making the whole of Northamptonshire a really attractive place to work. I know we see, certainly in the Integrated Assurance Committee and Performance Committee and in Quality Committee, various aspects of that bring that all together, and we see the impact of that when it goes well, and certainly when it doesn't. So the assurance, I think, is that it's been worked at lots of different levels, and we do test that out, when we're on service visits. Thanks.
Thank you, Julia. Mark.
Thank you. I mean, the first thing to say, it's really good to see the level of oversight that's coming through and the transparency around that. So I suppose I'd I'd make the connection that the world in which we're living in and will continue to live in for the foreseeable future is, it's one of rising demand. One in 10 posts within health and adult social care are vacant. There's higher agency spends, and in amongst all of that, there's poorer outcomes for patients and carers, and a bigger risk of those happening. And I just wonder if the following's being looked at closely enough, and that's closer working with the voluntary sector and also multidisciplinary team approaches with voluntary sector and adult social care, because there's kind of clear evidence and data within approaches in other areas like mental health and learning disability pillar, the Age and Well programme and the dementia pathway around that having really positive outcomes. And NHFT has actually been a key leader in driving that set of things forward. So I just wonder if there's some things to learn from there against some of these bigger issues as well, and also the success of things like community asset group approaches. So it's the point that was just made around drawing our eyes towards innovation and new ways of doing things. Whilst it won't answer all of those things, it could be an answer for some of them, and some of those things may make the biggest difference to patients and carers. Cheers. Thank you.
Thank you very much, Mark. I'm conscious that we're a little bit behind, and I know Angela needs to cover her report. Angela, I wonder whether, do you want to comment on Mark's point about the role of the VCSC and the sort of community asset point? And I'm just conscious that I wanted to bring you in to do your item anyway, but I wondered whether you'd like to just comment on in response to Mark's question, and then I can leave you to carry on to just cover off what you wanted to in terms of what's top of your agenda. So have you got a thought about what Mark said around the role of the voluntary sector?
Yeah, so thanks, Mark. And absolutely, I think what we're seeing and what everybody's describing is clearly, as Scott said, a really wicked challenge, but you can't solve this on your own. And I think, as Mark said, we work very much in partnership. Developing partnership is part of our strategy. And increasingly, we've got examples across the trust where we are working with the voluntary community sector to support our workforce. They are our workforce too, and they're working with us on integrated pathways, and we've got some great examples of that. So I think we've got to challenge ourselves further on it. We've got also good career pathways in terms of volunteer to career. Those are really good examples of future pipelines that I know Chris is particularly supportive and championing. But I think it's exactly as Mark describes. We've got to work more and more across the sectors, because solutions in organisations don't exist. And just to give an example of working beyond the organisation, just to sort of describe some of the problems we've had around access that have already been mentioned, we're doing a lot of work across our group to make sure that practice is being learnt, that we've got some joint roles where that can add value. And we're also across the East Midlands Alliance looking at how, with the HR directors, we can think about those sustainable longer term solutions for workforce, whether that's retention, recruitment or capacity building. So I think it is about a multi-sectoral approach to it. It isn't about NHFT solving it. And Mark's absolutely right. It's about working with local communities. That's the voluntary community sector to actually get the solutions. And I'm confident we have an approach that does that. But what I would say is there's always more to do.
Thanks, Angela. Shall we let you also do your report then? Because I know you're a little bit time constrained, Angela. So do you want to, I think we'll take the Chief Exec's report that we shared with you as read, although you're welcome to ask any questions about it. But I'm always interested to know what's on top of Angela's agenda for now, because there's always new things we're dealing with. So over to you on that, Angela.
Yes, thank you. And just to say, apologies that I can't stay, but for those who are interested, I'm heading up to Warwick University to the South Asian Professionals
National Alliance in the NHS, which is a really important alliance and one which we support, and I'm pleased I've been invited to go along and to have a meeting there. So hopefully that will be useful to us as well. So yes, as Krishni said, what we've tended to use this session for is to think about the things that are at the forefront of mind, perhaps 3 things I tend to think about just to provide some focus. And I just wanted to start initially with the Lucy Letby case in the NHS, which of course everybody will have heard about, and clearly that has impacted the NHS and everybody within it. So that is absolutely affecting all of us. You can't be working in the NHS and not be affected by it. Of course, there is a lot of media around this particular case, as expected, and that also affects people too. So several things there. One is to make sure that we continue with our culture and our conditions about people speaking up. This is so important. Safety first, everybody's job card, making sure that we can remain confident that people do speak up and will call out safety issues. But of course, also supporting staff who've been impacted, because clearly that has also been the case. That's one of the things that is occupying my mind. The other one is about striking the balance, and I'll just share a little bit more about what I mean by that. So I think we've already heard through examples so far about the challenges in the NHS, and I think, you know, whether that's the legacy of COVID, which is clearly there, whether it's the industrial action, whether it's the access to services, the demand, or the challenges of the finances, they're pretty big. These challenges are there upon us all every single day. And at the same time, the balance is that we have some fantastic examples, and I mean fantastic examples, of great patient care, good partnership working, people improving practice every single day and putting safety first. So that balance of striking across the organisation, how we manage in that context, is something that occupies a lot of my time, and I know the exec colleagues as well. This affects staff because clearly, you know, the media, the outside world, the demands they're facing, as well as the fact that they are doing that achievement and celebrating success, is something that we do think about an awful lot. It's a difficult period for staff, it's a difficult period for our populations, but it's also a fantastic time of good integrated working, which we need to celebrate. And then the final thing I just wanted to mention that occupies my time is obviously we are in a period of Care Quality Commission inspections. So we've had unannounced inspections in our acute and psychiatric intensive care units recently. We've got some inspections in our prisons. These are always challenging times for people because there's obviously scrutiny and clearly a view from a regulator, but also lots of data requests which organisations have to respond to. And of course, we have to learn always once we get the feedback. So those things are always at the forefront of our minds in terms of what is it that is being said, what have people found when they visited our services, have they found good services, etc. This is really important, and our staff obviously are at the forefront of that. So I want to just say enormous thank you to all our staff who are supporting those at this time too. So those are the things that are on my mind, Krishni. There's many other things, but I've just tried to crystallise it into areas which I think people would recognise are significant for us. Thank you.
Thank you very much, Angela. Really appreciate that insight into sort of things that you're grappling with, and we are all grappling with, and all executive colleagues and members of staff. And really important to understand. I think the range of things that at any one point the team are dealing with in a really kind of complex environment, really. So, are there any questions about any of those points that Angela made, particularly, I guess, that sort of the CQC, the getting the balance right, because it is really important that we I think, you know, create an environment where staff still feel positive about what we're trying to do, and that's challenging when there are some difficult stories in the headlines, etc., which is some of what Angela was alluding to. So any questions or further comments that you want to bring up whilst we've got Angela here? Okay, I don't see anything, Angela. So I think on that note, we can let you go probably if you need to. I'll let you slip off as you need to. So thank you very much for that update, and thanks also to non-execs who talked us through those two key issues. I think what we'll be seeking to do is in future boards, we've got another board meeting coming up in a couple of weeks, 2 weeks today, and we will no doubt be hearing further about other areas that we might need to bring to the board's attention that the committees have been focused on. And so one of the things we've talked about is sort of really there's almost sort of operating a bit of a cycle of, we've discussed these issues at our board meeting that we are grappling with, that we haven't, we're not fully assured about, but that we're working on and we want to bring to the board's attention. We will use those reports to try and bring that back through to you so that you have a real sense of the kind of things we're dealing with. But I think it's really important, as Angela said, to make sure that we are also picking up the positive things. And I think Julia mentioned this as well. There are really good examples of really good practice going on in our organisation all the time and in the NHS. And so it's really important that in that getting the balance right message that Angela was sharing with us, that we will take the opportunity to highlight really good things that we're doing as well, and bringing that to your attention. So it won't always be the alerts that are coming up through to the board, but also the outstanding practice that we can be proud to share with you. So we'll keep that cycle going, but I hope you found that helpful as a starter for 10 on some of the issues, the wicked issues as we would describe them, that we're grappling with at the moment. So I'm going to move us on then to talk about other council matters which are more constitutional in nature. And first and foremost, under item 7, we have the Director of Corporate Governance report. And on this, I'll hand over to Richard. I think, Richard, this is your first meeting as Director of Corporate Governance as opposed to Interim Director of Corporate Governance. Am I right in thinking that?
It is indeed, Christian. Yes.
Yeah, so congratulations, I'm sure everyone would want to say to Richard. So I'm delighted that you're opening it on that note, Richard. So over to you.
Thanks very much indeed. Yes. And good afternoon, everybody. Yes, I'm really pleased to be here as the Substantive Director of Corporate Governance, delivering this report on behalf of the whole team, really. This is very much a team effort. So you've got the report as paper F in the of papers. I won't go through all of the detail in here, but instead I'll sort of highlight five issues. Really, firstly, I just wanted to offer my congratulations to Christian. I'm sure the council would wish to do so. Likewise for her appointment as chair at Leicester Partnership NHS Trust, which of course is our group partners. I think this presents a great opportunity for us as part of our group model with Leicester as we go forward. So many congratulations, Krishni. I know we've got some conversation later on in a later item about what that means in terms of opportunities for the council and the trust. The second thing I wanted to highlight is an upcoming event. I'm sure all governors will have this already in their diaries, but for the benefit of any members or others listening, we've got our annual public and members meeting, the annual general meeting of the Council of Governors, taking place just after the weekend on Monday, the 18th of September at 5:30 in the evening. It'll be on Microsoft Teams. And we would encourage certainly all council members and board members to attend, but equally any other members of the public, members of staff that would be interested in hearing about our work over the past year, in hearing about some of our plans for the coming year, but equally hearing from a couple of case studies, one illuminating some of the work our community dentistry service is doing, and another sharing some of the work of our crisis team in relation to the new crisis response vehicle. So even if you're not interested in the annual report and accounts, and I don't understand why you wouldn't be, but even if you're not, do come along then to hear about some of the exciting work happening within some of our clinical services. But if you aren't able to attend for other reasons, then as usual, there will be a recording available of the event afterwards. The third thing, as you probably expect with me being the governance lead, that I'd wish to highlight from the report is that we will be soon launching the annual effectiveness review of the Council of Governors. So we will be approaching all council members for their inputs into this important annual exercise, really seeking from you feedback on what's working well, what might not be working to your satisfaction, and any new ideas that you have about what we should be looking at introducing to the menu of options over the coming year. And as is customary, really, we'll be using a combination of an online survey and doubtless some discussions with you to elucidate some proposals that we'll then bring back to the council at a future meeting. So I think this is a really good opportunity for you as governors to provide your views on how things are working. So would really encourage you to get involved in that process that will launch hopefully shortly after the council meeting. The fourth area I wanted to highlight is a bit of a new innovation for us, is appended to the report as Appendix B. We've invited all governors really to make a pledge on how they will be undertaking their governor role over the 23-24 financial year, and I'm pleased to see we've got a range of pledges that have already been made. Some governors indeed making more than one pledge, which is really great to see. So what I wanted to do really was to thank those that have already made their pledges, and indeed those that have already delivered on some of their pledges, actually, which we'll see in green, and to encourage those that haven't yet had the opportunity to put pen to paper on their pledge to do so, not least because it illuminates the range of work that's happening by our governors on behalf of members, but also it helps to identify any areas of support that you might need from us in the corporate governance team or more broadly across the trust in actually delivering on your pledge. And it's worth saying that this links with the next item that Tracy will be leading on in terms of the work of the membership committee as well, in thinking through those pledges that are relate to engagement and membership, how we can then support you as well through that mechanism. And then the final area I wanted to draw out of the report relates to training. So I think it was the last Council of Governors meeting where we agreed the definition of what's deemed required training in the Constitution. This is essentially mandatory training, really, that all governors will need to undertake. Now that we've agreed that definition, we're again inviting governors to book in for that training. It's certainly a lot less onerous than it was in previous years, and we think much more tailored to governors' needs. So hopefully should be straightforward for people to complete. And we are asking governors to have completed that suite of training by the end of the calendar year. As always, if you are either struggling to access that or not sure what it is that you need to do, please reach out to me, Tracy, or Joe in the corporate governance team. We'd be really happy to help you with that. So I think that's all I wanted to say in relation to the report, Chrissy. So perhaps I'll hand back to you to facilitate any questions or discussion that might arise from it. Thank you.
Thank you, Richard. So I think it is a report for noting. There aren't any decisions to be made on this particular report, but very much welcome to any questions that anyone wants to pose about anything in the report that you'd like to explore further. Now, everyone content to receive the report and note the key points that are there. Great, thank you very much. Thank you, Richard, and thank you, very comprehensive. Now, item 8, we were due to have Sue Watts presenting her perspective as partner governor for Age UK Northamptonshire, and I know Sue she was here actually earlier, I think, but unfortunately she's been called away on an urgent matter. And therefore isn't currently with us, although she may be able to rejoin us at a later point. So I suggest that we defer that in the hope that she will be able to rejoin us shortly. if she isn't able to, then we'll have to defer that for to a future meeting. Just a reminder that the partner governor story, as we tend to call it, is, or any kind of governor story. We've had staff governor stories in the past, is to try and give people a kind of opportunity to explain a bit about their role and how they're the kind of constituency they're representing. And I know Sue would have wanted to share her sort of work around supporting older people in our community. So let's hope that Sue can rejoin us later, but if not, we will absolutely come back to that at a future meeting. So we'll move on to item 9 for now, which is our membership and engagement report. And I think Tracy is going to present this report. So over to you, Tracy.
Yes, thanks, Christine. So on the 17th of August, we had I wouldn't say our first, but probably our most recent meeting of the newly reformed Membership, Engagement and Representation Committee. We had 7 governors there, I believe, so we had quite a good discussion. So to start with, we sent out some pre-information, really, just reminding governors of the membership priorities that we had set, which we'd set 5 of them, which is included in the paper. The focus of the meeting was really on 2 of those priorities, which was improving representation and engagement with children and young people, and also improving representation engagement in relation to equality, diversity and inclusion. So we had quite a good discussion, and I think that the governors that were there sort of came up with lots of different ideas, which I've noticed in the paper, from engaging with some of our internal networks, such as the Children's Participation Team. Use of social media came up, whether we could use social media to engage with young people. There was lots of things, including even use of local media as well, what we can do with that as well. So there was lots of suggestions. But essentially, the discussion, we realised as we went through both items, we almost drilled down into 7 actions, which you'll see in the report. So I'll sort of summarise those 7 actions that were sort of agreed from this meeting, which came out as the overall themes. So it was suggested that we should analyse sort of whether we could set a membership target, particularly looking at data, looking at our sort of patient population or the population itself, as whether we could set a target. We also said we should look with working with existing networks and forums and engaging with these 2 groups. And we mentioned the participation team, which was one of them. It was felt we should probably review our membership materials to check that they work for both audiences that we were discussing. We also said that there should be an opportunity to link our membership activity to the trust strategy. And one of the examples that came up was the Together Against Racism work that was going on. So whether there's something we can actively do there to link together. We also felt we should review and adopt good practice from other trusts. So clearly there's other foundation trusts across the country. So I'm involved with a network of membership leads across the country. So I certainly will link in with those. We also said that we should sort of engage directly with these 2 groups, children and young people and equality and diversity, to see what they would want from us. So there were some ideas about whether we could invite some of these groups to council meetings or workshops and have a discussion with them directly. And then finally, we also felt we should actually find out what networks our own governors are linked to see where they could help us promote membership engagement, which could be recruitment or it could be engagement. So they were the 7 sort of core themes that we identified throughout the workshop. Some of the governors present did volunteer to take part in some of those 7 themes. Essentially, what we're asking for here is that governors come forward and volunteer and help us, because we'll now take these 7 themes as our sort of action plan across those 2 themes. So we're asking for governors to sort of come forward and help support these 7 areas. So some governors have already come forward through the workshop, but we're asking sort of all governors present, if they're particularly interested in any of those 7 themes, to let us know. And we can also use the pledges to sort of to link governors up with those items. And I think finally, the last part of it really is the next steps, which is then turning these into an action plan. So we'll now move forward with the governors who come forward with myself to try and develop sort of action plans on these 7 items. Some actions we're probably already doing, but some of them clearly we need to work on. So they're probably the key things I wanted to draw out in terms of the workshop. I did just want to highlight on the other membership priority on the staff opt-out. Since we had a meeting yesterday, I thought I would just mention the priority on the staff membership opt-out. we had a good discussion with Starside yesterday, who were quite supportive of us moving towards this direction. So we're now just going to get on with the practicalities of moving towards opt-out model for staff membership and moving towards the single constituency. So removing the classes we've got currently of sort of the doctors and dentists, registered nurses, etc. So that piece of work is also moving on. So I just thought I'd highlight that as well.
Thank you very much, Tracy. And I'm just conscious, I think, is everybody clear what we mean by opt-out model? Is that something, I was trying to remember when we first surfaced that was something we were going to take forward, or whether actually newer governors might not appreciate exactly what we mean by that.
Yeah,
Tracy,
do you want me to
explain? Just clarify? Yeah.
So one of the priorities we set was to move towards the opting out for staff membership, because currently, rather unusually, we're probably one of the only foundation trusts where staff are not automatically sort of enrolled as foundation trust members. So staff have to choose currently to opt in. So we are proposing, which was agreed in principle in January, I think it was January's council, that we move to the opt-out model. So that would mean all staff are enrolled as members automatically, and that would be new starters and current staff. One of the first pieces of work we'll need to do clearly is to change the constitution, and then we need to ensure all current staff have the opportunity to opt out should they wish to do so. But that's what we're moving towards now. So that should be quite positive, because one of the reasons we're doing this, of course, is to make it so we get more engagement in elections, we have more contested seats, and hopefully have a strong staff governor group going forward for next year's elections. So that's sort of good work in progress, and we should be bringing that to November's council, the actual constitution changes in relation to those.
Thank you, Tracy. And I think one of the things that it might help us to do as well is also really make sure that our staff really kind of familiar with the role of governor, because actually it's sort of sometimes because people don't always encounter governors in their day-to-day work, that actually they don't necessarily get that familiar with the role of governors. So hopefully engaging with engaging in the membership arrangements will also give staff the opportunity to, as you said, Tracy, give a bigger pool of people who can become governors in the future, but who can also engage with these governance arrangements, which I think would be really good. But people will have the opportunity to opt out if they wish, which is also really important. So any questions on any of that, and anything to add from people who were involved in those discussions? There were clearly some colleagues from the council who were involved in those discussions. Anything that anyone wants to add to what Tracy has reported? No, Joanne?
Yeah, just to say that it was really inclusive, and I think people really did find that they felt involved and they created ideas, and so it was a really positive experience. So just to share that.
Great, thank you very much, Joanne. So the council is really just asked to endorse the particularly the sort of approach and the 7 actions that were identified by colleagues working together in the way that Tracy and Joanne have recognised. And I think post-meeting for people to perhaps put their, I think, Tracy, will you write to everybody just to remind everyone that this is what you're asking
it's
for?
It's provisionally in the mailing for tomorrow to ask people to come forward. So
come forward,
governors have a chance to respond.
Yeah, so if you want to get involved, you'll have an opportunity to respond to that after tomorrow's mailing. But in the meantime, to endorse the approach that's been outlined in the paper. So can I take that as agreed, unless anyone's got any concerns about that? Okay, great, thank you very much. So and David has helpfully shown his support for Joanne's comment as well. Okay, so that's item 9 on our agenda today. We now go on to item 10, which is some constitutional amendments that we require your support for. always conscious that changes to the Constitution don't seem the most exciting things in the world to talk to you about, but actually they are really important to us, and we do have to get your approval to changes to the Constitution, and indeed need to get the board support as well. It's the important role that you play from a governance point of view. So over to you, Richard, to just highlight maybe the nature of those changes that are being proposed. Thank you.
Thanks, Krishna. Yes, rest assured, everybody, I'm not going to go through every individual change, otherwise we would be here for some time. So firstly, I'm obviously referring to paper H in your packs, which is both the summary report, a schedule of the changes, and then the actual changes marked in as onto the Constitution as track changes for those wishing to see the detail. Secondly, I wanted to thank Peter Howie, who many of you will know. Peter has undertaken this piece of work on our behalf. We're very grateful to him. He's brought his significant experience and expertise to this. So thanks very much to Peter. The changes listed really come from the fact that we've had some legislation changes and changes in national guidance since we last did a substantive review of our Constitution. So it was really a good opportunity for us to then take a look at our Constitution more holistically. As Tracy mentioned, we've looked at segments of our Constitution over the last year anyway. So you'll see from the summary paper that some of the things that we've done is to really bring ourselves up to date in terms of current good practice. So we've removed references to chairman and replace them with a gender neutral expression, and we've also then removed references to some of the aspects of the Constitution that related to the original formation of NHFT from the previous NHT at inception. Perhaps some of the more significant changes that we've brought about in this Constitution are to recognise some of the changes that have happened in terms of the way the Trust operates. So not least, Dave Mayer now has taken on the Managing Director role within the organisation. So this proposed set of changes includes recognising that important Managing Director role as a member of the board. So you'll see that proposed amongst the changes. And we've also clarified some of the aspects in relation to the governor's roles within the Constitution, which had historically referred to the lead governor, when actually in terms of current practice that is in fact a duty for the whole Council of Governors. That's indeed how we've been working. So I think overall the suite of changes aren't really so much of as a revolution as an evolution in terms of what we've had previously. And as Tracy said, we will be coming back again in November with some further tweaks in relation to membership. So Christian, I'll probably leave it there rather than go into lots and lots of detail, but we'll happily take any questions from governors on the proposed changes. Of course, we are looking for the Council of Governors support for these changes, which will then in turn be considered at the Board of Directors meeting at the end of the month, before hopefully being approved and enacted as our new Constitution. Thanks very much.
Thank you, Richard. Are there any questions or comments about the proposed changes? No. So can I take it that colleagues are happy to approve the proposed revisions as set out in the paper? And as I said, this will need to go through to the board as well, because any changes to the Constitution are required. Both governance fora are required to support. So everyone content to approve them, and then we can take it forward to the board. Great, thank you very much. Okay, well, we have somewhat speedily brought our formal business to a conclusion because of one of our items being, I think, being deferred for now, and I'm not aware that Sue has come back in, so we can't continue with that item. I believe we've covered everything else, so there is an opportunity, you know, as we've got a little bit of time, we obviously I can open up to any other business, but were there any other questions or comments that people wanted to make from any items earlier? I was conscious that I moved us on to the item that Angela was covering. If there was anything else outstanding in relation to the agency questions or waiting lists, which were the two things that we were talking about, then do come back to that if you'd like to. But equally happy to pause that there and just bring matters to a close earlier if we need to. So any outstanding issues or questions that anyone would like to raise? Okay, no, I don't see anything. I think David waved, but I think he was about to head off, wasn't he? I suspect. So I think that's probably why, because I know he was in a different meeting. So I suggest we bring our formal public meeting to a close. We do have some items for our private meeting, which was actually due to start quite a bit later in just after 5. Can we perhaps go straight to that and start that meeting at 4:15? So literally just with a very short break, because I imagine that they'll be probably fairly straightforward, do we think, to deal with? And I'm sure that colleagues would rather finish everything earlier rather than have a break now and then extend things, if that sounds all right. So it's a matter for governors, really. If governors are happy, then we can start our private meeting at 4:15, if that's okay, which is on the next link, which will still work even if we start a bit earlier. Is that okay with everybody? Great. Right, see you there shortly, and thank you everyone for your contributions today. Thank you.
All right.